Determining Heart Rate on an ECG Strip by Dr. Douglas Ma.
When looking at the rate, there are two different ways of figuring out what a patient's heart rate is on an ECG tracing. The mathematical way is counting the number of small squares between each QRS complex. Each small square is 40 milliseconds. Counting the number of squares between each QRS complex and multiplying it by 40 milliseconds gives you the cycle length of a patient's heart rate. You then divide 60,000 by this cycle length, and this will give you the heart rate in beats per minute. Another way to do it is the estimation method. If you presume a QRS complex starts on a thick line, and then you count 300, 150, 100, 75, etc., you can then see where the next QRS complex lands and get a rough estimation of what the patient's heart rate is. For example, what is this patient's heart rate? If we do the mathematical method, we can count 21 small squares between each QRS complex. 21 multiplied by 40 milliseconds gives you 840 milliseconds. If you divide 60,000 by 840, you get 71 beats per minute. Now, if we do the estimation method, we then find the QRS complex closest to a thick line on the EKG. You then count 300, 150, 100, 75, and you can see the next QRS complex lands around this area. This gives an estimated heart rate of 75 beats per minute, which is pretty similar to the 71 beats per minute we calculated mathematically. Another way to do it is divide 300 by the number of large squares between each QRS complex. For this example, divide 300 by 4. This gives an estimated heart rate of 75 beats per minute.